Have you ever noticed your cat squinting at you? Sometimes it's just the cute, slow blink of affection, but if they're doing it a lot or keeping one eye closed, it could mean something's wrong. I'm Lyndall from Vetster, and today we're discussing why cats squint and when it can be signs of a bigger problem. As usual, all of the information in this video has been carefully reviewed by leading Vetster veterinarians. Alright, let's hand it over to the experts.
Sometimes cats squint for totally normal reasons, like if a light is really bright or something moves close to their face. But if your cat is squinting a lot, blinking over and over, or keeping one eye closed, it usually means their eye is irritated, injured, infected, or dealing with something else that needs attention. When a cat keeps squinting like this, it's often due to something called blepharospasm. That's the repeated, involuntary closing of the eyelids. It can affect one eye or both, and it happens when the eye is irritated or painful. Blepharospasm can be triggered by bright light, something stuck in the eye, airborne irritants like smoke, or inflammation from an injury or disease. Unlike a relaxed, slow blink, this kind of squinting doesn't stop, and your cat may seem unable to fully open the affected eye. You might also notice redness, discharge, tearing, or your cat rubbing at their face. One of the most common causes of abnormal squinting is eye infection. Pain and inflammation from an eye infection can make a cat squint, blink excessively, or hold their eye shut. The most common infection in cats is conjunctivitis, which affects the outer membrane of the eye. While many organisms can cause eye infections, most feline conjunctivitis cases are linked to upper respiratory infections, including feline herpes virus, chlamydia, and calicivirus. Other causes can include certain fungi, like cryptococcosis, as well as mycoplasma and even roundworms. Because these infections are often part of a respiratory illness, you may also notice coughing or sneezing, eye or nasal discharge, lethargy, a reduced appetite, or even vomiting or diarrhea. Another major cause of squinting is eye injury or irritation. Cats can scratch their eyes during play or fights, develop corneal ulcers, or get foreign material trapped in the eye. Airborne irritants like dust, smoke, chemicals, and air pollution can also cause discomfort. Very bright UV light, including glare off snow or light pavement, can irritate the eyes too. With injuries or irritants, you may see red eyes, discharge, and frequent pawing or rubbing at the face. Beyond infections and injuries, other eye conditions can also cause abnormal squinting. These include dry eye, eyelid or eyelash disorders, eye tumors, and allergic conjunctivitis. Because so many eye conditions look alike, an accurate veterinary diagnosis is essential. To figure out what's causing the squinting, a vet will start with a full physical exam, including a detailed eye exam. Some problems can be identified just by examining the eye with a light and magnifying lens in a dark room. Other cases require additional testing. This may include a fluorescein stain to check for scratches or ulcers, a Schirmer tear test to measure tear production, and a tonometry test to measure eye pressure. Your vet may also recommend blood work, testing for infectious diseases, bacterial or fungal cultures, cytology, imaging, or even a biopsy. These tests help rule out possible causes and pinpoint the exact problem, which is necessary to choose the right treatment. Not all eye issues require treatment, and some may heal on their own or with supportive care. Others need veterinary treatment, which can include medicated eye drops or ointments, oral medications like antibiotics, antivirals, anti-inflammatories, or pain relief, allergy treatment, removing foreign objects, wound repair, or surgery. If your cat has an upper respiratory infection, your vet may also recommend supportive care at home. This can include applying a warm compress, gently cleaning discharge from the face, increasing heat and humidity in your cat's environment, and offering warm, moist food to encourage eating. Don't worry, not every squint is a crisis, but it's worth knowing the signs that mean it's time to take action. Anytime you notice changes in your cat's eyes, including excessive squinting, it's a good idea to talk to a vet. Even if your cat seems fine otherwise, eye problems should not be ignored. Prompt treatment helps prevent infections from getting worse, relieves discomfort, checks for underlying disease, and reduces the risk of eye damage or vision loss. If your cat has obvious eye trauma, something stuck in the eye, or if the eye looks dislodged, that is an emergency and immediate veterinary care is needed. And if you're unsure whether your cat's squinting is abnormal, you can book a virtual appointment. Vetster's team of online veterinarians is here to help. If you're curious about other cat eye conditions, we've also covered topics like third eyelid problems and why your cat's pupils might be different sizes. You can find those linked in the description or on screen now. Thanks for watching. We'll see you in the next video.